CBM Television, as well as Love TV and several other radio entities. The Prime Minister is now at the podium. Mr. Prime Minister, good evening.
Good evening, ladies and gentlemen. Thanks for joining us this Sunday evening. Before I start my presentation, I want to address an issue which occurred last week, and that is the shooting death of a Jamaican lady in the Augustown community, Susan Bogle. The circumstances behind the shooting are still under investigation. And given the established protocols that now exist regarding such shootings, where there is an independent commission of investigation who takes over these matters and who has been doing a very good job in ensuring that justice is done. Nevertheless, I feel compelled to make a brief statement on the matter. And my perspective was influenced because this morning I called the son of the deceased, a young man who I had an extensive conversation with, and very impressive young man, the best of Jamaica, what we would want to see all our young men aspire to. And I was very moved, very touching story. Someone from the inner city who is doing well, who is trying to make the best of life, who has responsibility for his entire household, including persons who are otherwise abled. And now to have the burden of the loss of his mother. I was particularly moved, and I comforted him. But the statement which moved me was that he didn't want his mother's death to go in vain or be ignored by the state. And I found that to be very profound. And Jamaica has sacrificed much. We've gone through a rough period in the 80s and the 90s and the early 2000s in trying to establish in law and in process that when someone's life is taken, especially if it is by the state, then there must be established protocols with a higher standard of investigation. And these protocols have been operating now since the passage of the Indicom Act. But there is still a sense where people feel they don't get social justice. And it is imperative that the government at all times reassures all citizens that the government cares. The government will ensure that nothing in these matters will be hidden, will be swept under the carpet, that the social and economic status of the victim does not determine the outcome of justice. And I had what I felt to be a very good talk with this young man, and gave him the assurance that in no way, shape, or form will there be any attempt to cover up, that we will seek to have justice done in this matter. And it is really very sad. It is still within the context of managing the pandemic disaster which we face. Our security forces are at the forefront of this. The criminals have not stopped. The shootings have not stopped. And our security forces have to be on the front line. And when our citizens lose their lives in these very unfortunate circumstances, it behooves me to assure the nation that the laws that we have in place and the processes that we have established will be followed in their entirety, totally, towards justice. I want to welcome this evening Jamaicans and friends from overseas who may be joining us virtually. As you know, a number of measures in the existing order under the Disaster Risk Management Act will expire today, May 31st, 2020. The purpose of today's press conference is to inform the public about the measures that will be in place as of tomorrow, June 1, 2020. We have been indicating now for the last 2 weeks that we will move into the next phase of our management of the pandemic. We have been successful so far in our efforts, which we have focused on containment. We had our first confirmed case of COVID-19 nearly 12 weeks ago. As at yesterday, we had a total of 581 confirmed cases. I'm told, Minister Tufton, that we now have an additional 5. So as at today, we would have 586 cases, of which we had 290 persons recovered. What's the recovery today, Minister Tufton? 21 additional recoveries. Unfortunately, we had 9 deaths, and that number still remains the same. And we currently have 2 persons critically ill. So as of yesterday, our active cases would have been 282, much less today, given that we had 21 recoveries. I want to display my usual graphs to give us a sense as to how the epidemic is progressing. So our first graph displayed on your screen, the solid black line, which you should now be seeing, is the cumulative number of cases as of yesterday, which would have been 581, today 586, I believe. The dotted line, which is now appearing on your screen, displays the number of cases without the workplace cluster. And we keep pointing this out because it is important for the public to understand how the pandemic works, how the disease works. It just takes one uncontrolled cluster in an environment that is conducive for spread, for the numbers to rise exponentially and rapidly. Now, the red line represents the 9 deaths, as is depicted on the graph. The green line that you'll be now seeing shows that we have had 290 persons recovering as of yesterday. That number certainly is more today. The final line in the graph, which is the blue line, shows the number of active cases. That is the number of cases less recoveries and deaths. So you will notice the acceleration in our recoveries, the green line, and you will see that the green line is now overtaking. It has now moved above the blue line. Therefore, the number of persons who have recovered now exceeds the active cases. And that's a good sign, but I hasten to say it is not a time for complacency. It can change rapidly over a very short period of time. Now, the second graph to be displayed on your screen shows how our actual cases track against various doubling curves, starting from the point of our first 100 cases. The graph, as displayed, now shows the 6-day doubling. So at the initial start of the workplace cluster outbreak, you could see that we were tracking the 6-day doubling, meaning that we would have doubled our cases every 6 days. Then you're seeing the 8-day doubling, the 12-day doubling, and the 20-day doubling lines. And now we are moving now on a 35-day doubling. Now these curves project how many cases we would have if cases doubled every 6 days, every 8 days, or every 10 days, for example. The shorter the days to double, the steeper the curve, and the faster the growth. Now, when we add the solid black line, which shows our actual number of cases, you will see that we were briefly on the red line, which, as I said before, was a 6-day doubling. And that is the 6-day curve. Now we've moved across. We went to the 8-day, which is the green line, then the 10-day, which is the brown line. Then we crossed that. We moved to the 12-day doubling, which is a purple line. And now we're approaching the 20-day doubling curve, which is the orange line. And if our cases continue to move at that level of increase, that rate of increase, we will cross that in a few days, and we will head out more towards a 35-day doubling. Now, if we are on a 20-day doubling, as of June 20, we would have 1,162 cases. So if anything were to happen and our numbers were to rise according to a 20-day doubling, in other words, if there were to be another workplace cluster outbreak, or people decided we're not bothering to wear masks anymore, or people decided they're not going to follow the curfew regulations and go out and start to party, then you could see our numbers double by the 20th of June. That means we would have over 1,162 cases. And it can happen. So I want to just put that in the consciousness of the public. The dotted black line on the graph shows that if we did not have the workplace cluster, we would have been tracking the 35-day doubling curve, which is the blue line. If we maintain the protocols, if we follow the orders, we will get back on that tracking, which is the best thing that we could hope for in the management of the epidemic. Now, it is encouraging that our doubling rates has slowed, and the curve is flattening. This has brought us time, as we have had a smaller fraction of our population infected, and therefore our healthcare system has not been overwhelmed. We must maintain the measures that we have in place and continue to act responsibly in order to continue to have a flatter curve. The large effects that differences in doubling periods can have has been clearly illustrated by what happened in the earlier stages of the pandemic if we compare to Italy and Japan. So on the 23rd of February, both countries had approximately 140 cases. However, Japan's doubling period was close to 8 days, and Italy's was initially less than a day. So 8 days later, Italy had 1,700 cases, and Japan had 254. So what that demonstrates to you is just how fast the number of cases can rise. The doubling rate is one of the tools that we use to see how well we are flattening the curve. If we each continue to be diligent and exercise great care, that is to continue being strong fences, then we will remain on a flatter curve. Like most countries globally, our economy has suffered a severe setback as a result of the pandemic. The Planning Institute of Jamaica recently reported a large decline of 1.7% in real GDP for quarter ended March 2020, and has projected a decline of 12 to 14% for the April to June quarter, and 4 to 6% for the fiscal year 2020-21 overall. This represents the most significant economic decline we have suffered in over 4 decades. It is therefore an imperative that we get our economy back to full productive capacity as quickly as possible. As of tomorrow, we are moving towards a broader opening of our economy. I cannot, however, that we need to do this in a safe way. We must continue to protect lives while securing our livelihoods. As we move to further relaxing a number of the control measures that we have in place, we are not relaxing any of the standard infection prevention and control protocols. And as such, measures such as wearing masks, sanitizing or hand washing and cleaning surfaces, and practicing social distancing, those measures which have served us well, we must continue to ensure that these measures are observed faithfully to control the spread of the disease. Please note, however, that if our numbers start to rise significantly, we will reimpose tighter restrictions. Our response to the pandemic will continue to be measured and proportionate, evidence-based, and situationally appropriate. I want to now turn to some measures. I will now outline the measures that will apply as of tomorrow, the details of which will be in the new disaster risk management order. Curfews. The day to next day, night to early morning curfews will continue in place starting 9 p.m. tonight to 5 a.m. tomorrow morning, day to day, until 5 a.m. on the morning of June 14th, 2020. In the night time of June 14th, the curfew will begin 10 p.m. through to 5 a.m. the following morning, day to day, until 5 a.m. on the morning of June 30th, 2020. Licensed public passenger transport, state or privately operated, are allowed 1 hour after the end of the curfew, that is between 9 p.m. and 10 p.m. until June 14th, 2020, and between 10 p.m. and 11 p.m. thereafter until June 30, 2020, to travel home from their last passenger drop-off, and 1 hour before the beginning of the curfew, that would be between 4 a.m. and 5 a.m. until June 30, 2020, to travel to their first passenger pickup. No passenger must be transported in their vehicles during the additional 1 hour period allowed for transport operators to travel to and from their homes. We have not specified opening or closing hours for businesses other than the general limits on the curfew hours. We encourage businesses and employees to optimize arrangements to increase productive use of time and safe travel. So, effective June 1 to June 30, 2020, stay-at-home measures. Now, stay-at-home measures are designed to protect the population that is most vulnerable to the effects of the declared disaster by placing a duty on them to shelter indoors as much as possible away from the threat. Assigning vulnerable or at-risk persons to stay indoors, significant effort is invested in public education to increase awareness and responsible behavior of the at-risk population. The main risk we are trying to minimize in this pandemic disaster are: 1, the risk of significant loss of life or impairment of quality of life if the virus is widely and indiscriminately contracted; 2, the risk of overwhelming state resources to the point where the state is unable to respond and to protect and save lives; And 3, the risk of significant, long-term, and unmanageable disruption to our personal livelihoods and the national economy and our way of life and society generally. Everyone, the country in its entirety, faces these risks. However, some persons have a higher probability of experiencing the worst of these risks: deterioration in health, inability to get health care, loss of income and reduced quality of life, and even death if they are exposed to the virus and contract the COVID-19 disease. The data suggests that the older population are more at risk, having a very high probability of dying if they contract the disease. Persons with comorbidities, such as diabetes, high blood pressure, obesity, and respiratory illnesses, especially if they are not under medical control and treatment, have a higher probability of having serious effects or dying from the disease than healthy persons. Therefore, if you are older, say 65 and above, you have one or more of the comorbidities, then the chances of dying from the disease is extremely high. Under the Disaster Risk Management Act, we have put in place orders requiring persons 65 years of age or older to remain at home, only going out once per day for the necessities of life, to include obtaining food, medical supplies and services, conducting financial transactions and oversight of their business affairs, attending a place of worship, and importantly, exercise. The essence of observation of this order is to limit your exposure to the general population among which asymptomatic spread is occurring, public places, and public transportation as much as possible. In determining your personal behavior and assessing your risk, the order is designed to place you in a frame of mind to only risk exposure for what is absolutely necessary and avoidable and unavoidable to carry on your life. The stay-at-home orders also applies to persons who may be ill and showing signs of a coronavirus-like illness, but are not confirmed by testing or assessed by a clinical expert. If you have come into contact with someone confirmed with the SARS-CoV-2 virus, or you're having a persistent cough, sneezing, high temperature, or exhibiting flu-like symptoms or serious acute respiratory illness, then you must stay at home, avoid the general population and the workplace, isolate from your household as much as possible, inform the public health system through the JAM COVID-19 app, and make arrangements to seek medical treatment, taking care to wear a mask and avoid public transportation. I want to address gatherings now. Gatherings continue, not the orders for gathering, that is, continue up to June 30th, 2020. Gatherings in public places should not exceed 10 persons. There have been questions and requests for us to increase this number. I think we have to be very careful. We are examining that number, but it is important in limiting spread to control gatherings. So for any such gatherings of 10 or less, social distancing, that is observing the minimum 6 feet apart, must be maintained. Although social distancing and other protocols will apply, there will be exemptions for workplaces to facilitate the increased number of employees in the workplace, and for companies holding their annual general meetings, AGMs. On this note, considering the challenges that companies are having now in terms of having their AGMs, which they are required to do by law, The Ministry of Industry, Commerce, Agriculture and Fisheries is currently reviewing the legislative framework to address this situation expeditiously. I want to address the wearing of masks, which we have been speaking about so far. Now, the wearing of masks, this will be extended to June 30th, 2020. Now, once you leave your home, you must wear a mask fitted to cover your nose and mouth. I have noticed a decrease in the number of persons wearing masks as I move about the country. I get many complaints, people sending me messages, people calling that our citizens are not wearing masks as much as they were 2 weeks ago. I've also observed that those who have masks are not necessarily wearing them correctly. As I said earlier, masks must cover nose and mouth. I know it is uncomfortable, and I have challenges too with it, but it is important to wear the mask and wear them properly. If you are caring for someone at home who has the virus or who has flu-like symptoms or respiratory symptoms, you must wear a mask even at home. And if you are going to seek medical attention, you must wear a mask on your way to and at the facility. As difficult and unnatural as it may be for us, we all need to accept that social distancing, wearing a mask, no handshakes and hugs when greeting others, avoid touching high-use surfaces, hand washing and sanitization are all part of the new normal of living with COVID-19. I want to talk now about restrictions for correctional institutions, and these will be extended to June 30, 2020. Restrictions on visitors to inmates of correctional institutions remain. No visitors will be allowed. Restrictions for infirmaries, hospitals, and nursing homes will be extended to June 30, 2020. The existing restrictions in relation to infirmaries will remain. This means no new patients will be admitted during the period, and no visitors will be allowed. The existing restrictions in relation to hospitals and nursing homes will also remain. Each patient can only receive one visitor per day. Visitors and staff must wear masks, sanitize, and follow all the protocols established by the institutions. These are, of course, institutions where we need to take great care and precaution to protect the vulnerable. We therefore continue to examine and standardize the protocols in relation to infirmaries, nursing homes, and prisons, which all have at-risk confined populations. Now, specifically in relation to the nursing homes and infirmaries, workers who come into contact with anyone who has been confirmed with or exposed to COVID-19, our workers in these facilities, they must report their contact to the workplace institution and to the Ministry of Health. They have a duty in the orders to report. Now, for infirmaries, the Ministry of Local Government and Community Development, on a risk assessment basis, will exercise its best effort to provide transportation for persons employed in these facilities. This is to ensure that there is an added layer of protection so that the workers in those facilities, if it is deemed necessary, would not have to contend with public transport. Now, in terms of markets and vending, these orders are extended to June 30, 2020. Operating hours for markets, vending in public arcades and public transportation centers will remain. These hours are Mondays to Saturdays, 6 a.m. to 6 p.m., and closed on Sundays. Orders in relation to barbershops and hair salons extended. We are going to extend these orders to June 30, 2020. Restrictions relating to barbershops and hair salons remain. That is, no more than 10 persons are to be in any one area, and no more than 2 of those persons must be clients waiting to be served. At this juncture, I want to commend those persons within this sector who, from the monitoring reports, have adjusted their operations and have been complying with the protocols. The business process outsourcing orders will be extended to June 30, 2020. BPOs will operate in accordance, subject to certification and operating protocols as agreed in consultation with the sector. These will be detailed in the order, and as stated previously, I've asked Minister Vaz to have direct oversight for this area. Work from home orders, as I had given notice before, will be replaced with a new set of orders, which we are going to title them Work Smart, Work Safe orders. So no one can dispute that the economic crisis spawned by this pandemic requires everyone to act in such a way as to save lives and livelihoods. To this end, having regard to the notice given 2 weeks before, we will transition from work from home orders to work smarter, work safer guidelines. The country must seek to maximize its productivity without compromising our health. By reconfiguring how, where, and when we work, by integrating technology and innovation in all our business processes, and generally increasing efficiency of our firms and well-being of our workers. While we are encouraging persons to go back to their place of work, we acknowledge that this may not be practical or feasible in all cases. We must examine our situational realities and determine what is appropriate. During the period June 1 to 30, persons listed can make a request to work from home. So, for example, persons who are immunocompromised with underlying illnesses that are not currently under control by medical treatment and are therefore at risk, such persons will be required to present a medical certificate indicating that they are not at this time fit to work in an environment of general access which may expose them to increased risk during the pandemic. Persons who have no other suitable arrangements to care for their children at home if they were to go to work, they can negotiate with their employers, and we expect that their employers will make the necessary provisions and arrangements. Of course, this will be put in the orders. Persons who have no suitable arrangements for caring for an elderly or ailing family members, those persons we expect to be treated similarly and exemptions be provided. Now, I want to spend a little time on the physical distancing measures to facilitate workers at the workplace. Now, where an employer assesses that the employee to square footage ratio will not allow for employees to have at least 36 square feet of functional space individually to facilitate the recommended social distancing space of 6 feet apart, the employer must make arrangements with some employees to have them work from home or staggered working hours or some other alternative arrangements to ensure that social distancing is possible to be practiced in the work environment. Further measures will also be included in the new order to ensure the safety of those returning to the workplace. These will include the operators of businesses to ensure that markers, physical distance markers, are placed to acknowledge the square footage of 36 square feet or the space of 6 feet apart. This would be necessary not just for the workers, but for customers who may be using their premises. And then social distancing rules will continue to apply throughout the workplace for everyone, staff and customers. Masks, as we had stated before, are mandatory, and a sanitization program must be in place. Hand washing stations and hand sanitizing stations and equipment should be readily accessible to both employees, visitors, and customers. Ventilation is also another critical area of concern, and as far as possible, natural ventilation is recommended. The Minister of Health and Wellness will give further details on the protocols that have been developed for Jamaicans to return safely to the workplace. Now, effective June 1 to June 14, 2020, a number of measures will be initially effective for a period of 2 weeks, during which time we will closely monitor compliance to determine whether or not they can be extended. Now, each individual has a role to play by exercising personal responsibility and care in daily choices we make. Public transportation. Now, buses will continue to be allowed to carry only seated passengers. However, after much deliberation, we will be allowing motor cars with PPV licenses to carry the number of passengers allowed by the license. We recall before it was one less. Now we're allowing the PPV private passenger vehicles to carry what the license obtains. Now, this is subject to all windows being open, the air conditioning being off, and masks being worn by all persons in the vehicle. Bars, places of amusement and attractions, bars which do not operate under the village retail license, nightclubs, other places of amusement, public beaches, water and other attractions will remain closed for the period June 1 to 14th. Community bars may be open from 11 a.m. and will close 1 hour prior to the start of the nightly curfew, subject to certain conditions, and I'll repeat those conditions: no more than 5 persons inside the bar, including the bartender, no seats, stools or chairs, or tables inside the bar. All doors and windows must be open. Social distance and wearing of masks apply inside and outside for operators and patrons. No more than 2 persons at a table on the outside, no more than 10 persons. That is, the public gathering restriction applies outside. And as I had spent an extensive period of time in my presentation explaining why we have to keep the stay-at-home orders for those persons 65 and over, no person 65 or over to be at any bar. From the monitoring that has been done, I can report that the bars have been largely compliant with these measures, and we will continue to monitor them closely. Within the next 2 weeks, we will continue to closely review the nature of the operations of the establishments of places such as places of amusement, public beaches, water, and other attractions, with a view to reopening them in a limited and controlled manner. We have been getting the calls People are saying it's summer, time is hot. They want to be able to go back to the beaches, their water parks. So we are looking at that very carefully to see what infection prevention and control measures can be put in place, what other orders can be crafted, the protocols that can be in place. And hopefully in another 2 weeks or so we can say something about this. Weddings. The restrictions on weddings are being modified to allow now for no more than 15 persons, including the person conducting the ceremony, to be present. In terms of places of worship, restrictions relating to churches and other places of worship, which include the following, will remain. In terms of the physical distancing rule, that will continue to apply within the sanctuary, the worship space, and that is a ratio of square footage to worshipers. That would be a 1 to 40 square foot ratio. They must continue their social distancing rules, and that applies throughout the church space. Everyone must stay at least 6 feet apart. Gathering rules apply for all other spaces outside of the sanctuary or the designated worship space. And needless to say, everyone must wear a mask. They must sanitize their hands. There needs to be a sanitization program in place in the church. For funerals, the restrictions for funerals will be modified. Well, they have been modified to allow for up to 15 persons, of which no more than 10 can be mourners. Now, I've been getting many calls in Clarendon, all over, in St. Catherine, of mass funerals still taking place. I have given a direction to the Commissioner of Police to ensure that all local police stations and officers in charge are strictly enforcing the funeral rules. We have seen an outbreak in St. Mary, which diverted significant resources in order to contain it. Our first case featured a funeral. Funerals are one type of gatherings that could potentially cause an outbreak. And therefore, I'm stressing that this will be strictly enforced. Now, the measures stated above for weddings and places of worship and funerals will, as I've said, continue to be closely monitored and examined for compliance to determine how they may be modified going forward. If persons follow the rules, are faithful and consistent in doing so, then we can gradually relax some of the restrictions. Now, the Minister of Education is here, and he will speak about the partial reopening of educational institutions. As of June 8, 2020, there will be a partial reopening of secondary schools to facilitate preparations for the sitting of CSEC and CAPE. You will hear more about that as the press conference continues. Now, extensive protocols have been put in place, and the minister, as I've said, will speak about that. Now, I want to focus now on controlled re-entry of Jamaicans. But before I do that, let me give an update on our Jamaican cruise ship workers who have returned home. So the home quarantine and monitoring solution through the JAM COVID-19 mobile app is now being used to monitor persons from the Royal Caribbean, the Norwegian and Carnival cruise ships who are in home quarantine. And it is working fairly well so far. These geo-tracking and monitoring measures are specific to containing the COVID-19 pandemic and are limited in time. We're not expecting to do this beyond the period of quarantine. They are executed by the appropriate officer of the state in law, which includes the security forces and health officials. Let me update on the additional Jamaicans who have returned home since my last update. From the Norwegian cruise line, we have had 175 Jamaican cruise ship workers. From the Carnival cruise line, we have 240. From the Disney cruise line, we have had 198. And then we had a JetBlue flight coming in on the weekend with 112. And then we had involuntary return Jamaicans, 28 of them. Then we had a charter flight from Fort Lauderdale with 29 persons. We have having a flight from the Turks and Caicos with 23, and a flight from Cuba with 45. Therefore, a total of approximately 2,300 persons have re-entered Jamaica under the controlled re-entry program to date. Now, I just want to say that this has been at significant cost to manage the re-entry program. And though we have not emphasized, but the process of ensuring that we are able to test and quarantine would have picked up a significant number of persons being positive. In fact, as is released every day, you can see from the release from the Ministry of Health and Wellness that the number of imported cases have more than doubled since the re-entry program. So we have to manage this risk, but it comes at a very significant cost. So we have new protocols now which will apply for controlled re-entry effective June 1, 2020. We will seek to implement new controlled re-entry protocols that will be based on a risk assessment of the countries from which persons are seeking to re-enter Jamaica. And of course, we will have to consider the travel routes which they will take. Countries that have a similar management and profile result for the epidemic regarding spread, death rate, infection prevention and control measures, contact tracing, protocols, and other such criteria could constitute a travel bubble that would determine the protocols that would apply to their re-entry. Persons seeking to enter Jamaica from countries within this travel bubble may not need to be tested on arrival. So they would, however, be subject to health status screening, including temperature checks for symptoms, in terms of observing if they have symptoms. And everyone must go through a sensitization program with public health officials, utilizing flyers and audio visuals. And we're also considering including a pledge document, which everyone coming in would need to sign, just as a sign of good faith that they will observe the protocols here that all Jamaicans have been observing and which has served us well. Based on their health status and risk assessment by a public health officer, Jamaicans seeking to re-enter will be subject to a mandatory 14-day quarantine. So during the period June 1 to June 14, all persons seeking to re-enter Jamaica will be subject to testing except for those entering from a country within the travel bubble as defined on our, which we will give the specific criteria of those countries we consider to be within our bubble. And for clarity, Jamaicans returning from countries not considered to be within our travel bubble would be required to be tested and quarantined at home with either phone or wristband geofencing. Now, as of June 15, non-Jamaican nationals will be allowed to enter Jamaica. Protocols regarding this have been established, and further details will be provided in due course. As of June 15, testing on arrival will be subject to the result of the public health screening at the port of entry. All persons entering Jamaica, however, will be encouraged to undergo voluntary testing at the port of entry, or they can make an appointment on the JAMCOVID app to be tested. As we increase the rate of repatriation of Jamaicans and then move to allow non-nationals, effective June 15, to visit Jamaica, we recognize that even with the best will and the most faithful implementation of measures, there is likely to be an increase in our confirmed cases. We must use our available resources in a targeted way to manage and mitigate the risk. We do not have the resources to entirely eliminate the risk. So as we move into the next phase in our management of the pandemic, and we relax some of the restrictions, indeed reconfigure some of the restrictions in an effort to get our economy back on track, there will be increased emphasis on every Jamaican taking personal responsibility. Our public health professionals have provided us with guidance on how the protocols that will keep us safe will be implemented. It is now up to each and every one of us to be strong fences as we transition to the new normal of living with COVID-19. Let us give thanks that we have managed this virus and that the number of cases so far have been low. My fellow citizens, please do not let down your guard. Keep following the guidelines, be faithful to the orders and the protocols, and let us together overcome this pandemic. I thank you. I will now turn to the Minister of Health to give his update.
Thank you very much, Prime Minister. So the Prime Minister has said quite a bit, and it is just for me to reiterate, to reemphasize some of the critical components, particularly as it relates to public health. Firstly, let me recognize all in the audience, my colleagues, permanent secretaries, Chief of Staff, the Commissioner of Police, and others. I want to begin by saying that the restrictions that are going to be eased, as announced by the Prime Minister in the coming weeks, starting tomorrow, signals for us in public health, as we have said, a new norm, signals for us in public health the importance of persons taking personal responsibility. The theme that we have been trying to project as it relates to confronting COVID is around the concept of everyone playing their part, everyone counts, because the reality is that public health is not the 17,000 or so members of the team across the country led by myself, the Permanent Secretary, and the Chief Medical Officer. We will not be able to control this virus, to keep the country safe from the impact of this virus, if every single Jamaican does not play their part, both in protecting themselves, in the first instance, protecting their families, and by extension, their communities and Jamaica. As we move in this new dispensation, this new norm, where everyone counts and everyone should know that they count in protecting our country, it's going to be important for us, though, as public health, to respond with the appropriate leadership as part of the Cabinet of Jamaica, led by the Honorable Prime Minister, to provide information so that every Jamaican understands what they need to do, to prepare the public health infrastructure both in terms of human capacity. So we're adding additional capacity in terms of our health centers, in terms of our clinics, to deal with what we have already concluded is going to mean more cases in the weeks and months ahead. And Jamaicans need to prepare themselves for that reality. It's not a reality that we are encouraging. It's not a reality that we are welcoming, but it's a reality that we believe we will have to confront, we will have to face. And the evidence to support this is very clear. Our first case of COVID-19 was on the 10th of March. First case. And first imported case. Up to the 6th of May, when we started to lift restrictions for controlled re-entry from persons coming in from overseas, whether as on cruise ships, as workers, or via our airports, we had 34 cases linked to imports, persons coming in. Since March 6 to today, since May 6 till today, the end of May, the 31st, we have had 55 new cases based on the lifting of those restrictions. What is very clear, is that with further lifting of restrictions that will take place starting this week and beyond, we are going to see cases grow exponentially. And it is our duty in public health to say to the Jamaican people, to say to all of us, that we all have to play our part in ensuring that we protect ourselves and we protect each other and by extension the country. We accept, we appreciate the importance of the changes in measures. We accept in public health that we need to move towards normality, economic activity, persons going back to work, going about their business in their social context. We know that this could not be a permanent arrangement. And for very good reason, the restrictions that were imposed up to now served an important purpose from a public health perspective in terms of preparing the population, preparing the public health infrastructure to deal with what we anticipate and expect will happen after the restrictions go. And so I want to just take the opportunity on behalf of the public health team to say to the country that we are prepared and continue to prepare for what we know is likely to be the inevitable once we lift or further lift the restrictions as announced by the Honorable Prime Minister. So for us, it is important that everyone understands that as more persons return from overseas, our numbers of positive cases will go up and there will be increased likelihood, and this is very important, increased likelihood of community spread, because the nature of the virus suggests that even with the screening that will take place at our airports and seaports, even with testing, there are margins of error depending on when the virus would have been picked up, the length of time that the virus is with the particular individual, for that virus to show, even if we do testing. And there are going to be persons, even with the 14-day quarantining at home, or even with tests, who will have the virus and will take the virus back into their communities. And the consequences of that clearly are that the virus is likely to spread at the community level. We can, however, and this is the hope that we have from public health and the encouragement that we are giving to the population, we can, however, stop the spread if we apply the measures as outlined by the Honorable Prime Minister and others in the advisories that we send out, the public education programs that are on media, social and mainstream media. Measures such as social distancing, measures such as personal and environmental hygiene practices. The truth is that all of us counts, everyone counts. We must take personal responsibility to protect ourselves, protect our loved ones, communities, and country. So while we have to conclude that the outbreak is not over, we believe that with these measures we can minimize and mitigate the risks that we will encounter beyond tomorrow. Maintaining a physical distance of 6 feet from each other, as said by the Prime Minister, is critical. Staying at home if you don't have to go out, important, particularly for persons who are of a particular age, 65 and over, with underlying conditions. Avoiding crowds. We're not accustomed to that. We like to socialize, but we encourage Jamaicans, if you can avoid for the time being, please do so. And of course, frequently washing and sanitizing hands and cleaning of surfaces where droplets may fall. The wearing of masks as part of the physical distancing, particularly when we're in crowded situations, we encourage as extremely important to avoid spread. And of course, if we're asked to stay home and quarantine for 2 weeks or beyond, we're encouraging all Jamaicans to follow those instructions. Quarantining at home is going to become the new norm because, as the Prime Minister said, we are not going to be able to have institutional quarantining arrangements for a longer period, under certain circumstances, but not for an extended period. And therefore, it is going to require Jamaicans to exercise the discipline to follow the instructions as given by the public health practitioners. As the work from home order comes to an end, businesses must ensure too that they adhere to the rules set out by the Ministry of Health and Wellness to maintain a safe environment for both employers, for employees, but also very importantly for their customers. I am not going to go through the workplace protocol in detail here because it's quite extensive. The ministry team, and I want to commend them for the work that they have done over the past month or so, have put together 27 protocols that covers a wide range of activity from clinical operations, lab operations, testing, to workplace, and in some instances, specific sectors, so the BPO, the tourism, and all of this information is available on the Ministry of Health and Wellness website, which is www.moh.gov.jm. So our workplace protocol can be downloaded from the ministry's website, and we urge all Jamaicans, particularly employers, but certainly employees too, and others, if they so desire, to visit the ministry's website, www.moh.gov.jm, and go to resources located at the end of the homepage and click on the COVID-19 resources and protocols. So once you get on the website, you go to resources, which is at the end of the homepage, and click on COVID-19 resources and protocols. And you will find all the protocols that are available and can download the ones that are relevant to your activities. In terms of a summary of COVID-19 workplace protocols, however, the COVID-19 workplace protocol is a guideline document to be used as a basis for decision-making by owners or operators of public establishments or facilities. Employers are to put in place the universal preventative measures for preventing transmission of COVID-19. These measures apply to all workplaces and all persons at the workplace, such as employers, managers, workers, contractors, customers, and visitors. And there are some key areas of focus which I'd like to just highlight. Hand hygiene, respiratory hygiene, physical or social distancing, risk communication, training and education, and provision of facilities for sick employees, for persons with symptoms. Those are all covered, and we encourage employers, employees, and others to visit the website and to particularly play focus on those areas. Again, I say it is important that we play our part and ensure that everyone counts as we restore normality under these new conditions in the protection of all our society. Finally, and in keeping with our daily announcement, I know the Prime Minister mentioned earlier, we're happy to report that we continue to see significant recoveries. Today, the last 24 hours, 21 more persons have recovered from COVID-19, bringing the total recoveries to 311. 5 samples have tested positive for COVID-19 in the last 24 hours. And as I said, that 5 is part of the 55 since the 6th of May when we started the controlled re-entry. The total number of confirmed COVID-19 cases in Jamaica is now 586. All 5 cases are imported from the repatriated Jamaicans who were processed in Falmouth, Trelawney, on the Carnival Glory cruise line, comprising of 1 male and 4 females. Actually, it's the Carnival Glory and the MS Marina, so both cruise lines. I want to also just add to what the PM had said earlier, that we did actually complete 206 or 204 additional crew workers yesterday, last evening, on one of the vessels. So we're actually going at a fairly good pace, 204. And so we're pretty much completing the process of clearing the cruise ship workers. And I want to again just recognize the efforts of the public health officials. Finally, 89 imported cases, 34 cases prior to the travel restrictions, 15 cases from flights returning from the UK, 8 cases from flights returning from the USA, 216 cases of contacts of confirmed cases, 27 are local transmission cases, not epidemiologically linked. 234 of those under investigations are linked to the workplace cluster, and 20 under investigation. In terms of testing, we have done 12,702 samples, 12,702 in addition to the 586 that have returned positive results. And in the last 24 hours, we have tested some 338 samples. We have 294 patients in isolation and 779 persons of interest in quarantine at government facilities. Thank you. The results of the infirmary. Let me get that and then I'll give back.
Thank you, Minister. I now invite Minister Samuda to give us an update on the partial return to the classroom. Minister Samuda is making his way to the podium.
Thank you very much, Prime Minister. Leadership of various ministries, Chief of Staff, colleagues. This evening, Prime Minister has asked me to indicate the progress made so far by the Ministry of Education to ensure that we are on track with the reopening of schools. Before starting, I just want to indicate, however, so that we'll have a good, clear understanding of the scope of what we're dealing with. We are expecting to have enter our school system 132,000 students. 76,000, which will be taking the CAPE and CSEC, and 56,000 for CSEC alone. That's the number that we're talking about. And this will require invigilators in the local school by the local teachers for refreshing the students when they enter on the 8th. But I want to move quickly to exactly indicate some dates for you so that those who get a little bit confused, as I do, with the various dates that we have to contend with. On June the 6th, the CXC students will return to school. June the 8th. On June the 26th, we will announce the students who have been placed in schools, which would normally come through the PEP. On July the 3rd, the CXC refresher program that we have put in place will end. On July the 13th, the CXC exams will start. That will include CAPE and the CXC from the 27th, as we had announced earlier. It has been brought forward through a process of collaboration with our colleagues in the Caribbean and the leadership of the Overseas Examination Commission. And it was felt that our desire to have these exams out of the way, certainly for Jamaica before independence, we arrived at a date of July the 13th. On July the 31st, CAPE will end, only CAPE. And by August the 4th, the CXC will end. September 7th, all classes will start in the new school year for those students who were not involved in taking of these exams. 3 weeks of September, the results of the CAPE will be published. 3 weeks into September, we will publish the results of the examination. And September the 30th, up to September the 30th, from the time we enter with the normal cohort until September the 30th, we will be engaging a refresher and assessment program so that we'll be able to tell exactly at what stage the students are, having gone through sheer trauma over the last few months. It is very important that we reiterate what was said before. I said it here 3 weeks ago, 3 press conferences ago, but a question was asked to the Prime Minister about assessment at the end of the period before they go to school. There will be no assessment or no marks, no exams taken locally this year. What will happen is that the students will go to school, and at that time we will use the first part of September, we'll use the month of September, to do a thorough assessment of the state of the readiness of each student. A number of trained guidance counselors and so on will assess the students, and where students are found to be incapable really of going on to another level. And in some cases, parents might get a little concerned about the progress of their children. We will have a program to hold discussions, to dialogue with the parents, explain the situation to the parents, solicit the support of the parents, and make the recommendations that will be satisfactory for all concerned. There was an issue about private schools and the financing of private schools. And obviously, where you have a situation where they have been badly affected, their flows are down, and they serve a very essential part of our educational program. They are our partners. And we help them in many ways, but not directly in terms of financing. What the Permanent Secretary and her team have come up with is, I think, a very good scheme, where we will need additional space to be consistent with the regulations as stipulated by the Prime Minister in terms of distancing of each style to the other. And we have identified areas within the school system that we do have some space that will be available. But we are seeking to utilize the facilities that are in the private school system and place some of our students in those schools, and we will underwrite the cost of those students. So in that way, we will not only facilitate the development of our own students, but we will also assist the private school system to finance and to face some of the challenges that confront them. The schools are ready. The Ministry of Education, by next Wednesday, will have completed their procurement of all the necessary things that are, all the masks, sanitizers, agents, cleaning agents, all that is necessary to protect the children and the teachers as they attend school. Actually, as we speak, well, maybe not as we speak, but certainly by Monday, the process of cleaning all schools will be engaged, but remembering that the initial cleaning is not as dramatic as those that will follow, because the schools have been closed for 3 months. So we will be engaging that, getting schools ready, all sanitation ready, all leaking roofs, and all the things that would cause any delay going forward are going to be ready and will be ready on time for the opening in September. For those students that would still be challenged, and where accommodation has a role to play in that, we will be engaging in the virtual training on matters particularly of health, and in collaboration with the Ministry of Health. The Ministry of Health has been very useful. They're so preoccupied with COVID, but they have found the time to be engaged with the Ministry of Education in a very fulsome, and we are all very appreciative. And I want to take the opportunity, Prime Minister, I don't always do it, but I want to commend the Minister and his team for being so attentive to the needs of the children of Jamaica through the educational system. I want to put that on the record, and I know that the Permanent Secretary and her staff, the CEO and so on, will support me on that. We have been engaged in a process of dialogue where participation of board chairmen, principals, and proprietors of various schools and others have been engaged in a process of orientation and sensitization. And this will continue. One was held on the 29th, and it will continue until June the 2nd to include deans of discipline and others, and guidance counselors, school nurses and others. Students and teachers with comorbidities and special needs will not be required to come to school at this time. We are ensuring that they don't come to school, and so that there will be maximum in the protection mechanisms that we put in place. Teachers who may suffer from the same ailment will not have to come, certainly at this round of invigilation and so on, and assessment. And we will find replacements for them. And I'm sure it has been discussed, and they understand that we will find alternatives to deal with their particular concern. And we are very happy that up to now, we have not had any fear and trepidation of teachers who have to go into the classroom and see to the conducting of the examinations that we are going to undertake, that are going to be undertaken. And we are very satisfied that based on the preparations that have been undertaken by the ministry, with the staff that we have working on that, that they will be sufficiently satisfied to eagerly await the entry of school and participate fully in the program that has been laid out by that. So, Prime Minister, the only thing that I have to mention now is there are certain students that are challenged by getting from far distances to school. And the transport system is one that we are looking at, and we are prepared to support all the children who are on path. We wish we could support them in a more fulsome way. Perhaps the Minister of Finance, who is here, might lend a helping hand. But unfortunately, the look on his face is not very encouraging. So we will nonetheless do our best to accommodate the children getting to school. And the Minister of Transport is very eager to assist, and we're working on a mechanism to achieve that. Thank you, Prime Minister.
Thank you, Minister Samoura. I'll now invite the Minister of Finance to give a very brief report on the CARE program and the progress made or progress being made in ensuring that the beneficiaries are able to receive the benefit. Minister Clark.
Thank you, Prime Minister. Let me just start by saying that under the CARE program, $1.1 billion is being transferred to the Ministry of Labour and Social Security to supplement the PATH program. And so PATH beneficiaries who would normally receive 2 payments between the months of April and June will now receive 3 payments without the need to make any application. Just updating overall on the CARE program, I will begin with just an update on the number of applicants who so far have received transfers, and then I'll describe some of the challenges that we're having with bank accounts, and then just say a few words on the activity for this week leading into next week. Of approximately 375,000 applicants who were deemed to be eligible for compassionate grants, 337,000 transfers have been made in respect of 337,000 of the 375,000 eligible compassionate grant applicants. With respect to set cash applicants, and remember, set cash is for persons who were formerly employed who, after the 10th of March, were laid off. Of 30,000 eligible and applicants, and their eligibility having been validated independently by the Auditor General, we have transferred grants for 12,000 of those persons. The set cash grant transfers of 12,000 persons and the 337,000 compassionate grants that have been transferred have come at a cost of $3.6 billion, which has been financed by contingency funds available under the circumstances. Now, before I go in and speak about the other components, the general grants and the small business grants and the tourism grants, let me just address some of the challenges that we have had with the bank accounts that have been submitted. Initially, after the first round of eligibility was established for applicants, there were over 100,000 bank accounts that were invalid. And they were invalid for a number of reasons. They were, wrong account number, wrong branch number, the name on the account didn't match the name of the applicant, the account was dormant or deemed inactive, the identification on the account was expired. In some cases, we had, for certain financial institutions, where persons who had an account under a trustee relationship with a guardian, a parent, or an adult, but who passed the age of 18, were sending money to that account. But after 18, having a trustee account is no longer for certain institutions possible. And let me just explain that. You know, you have Mary Brown, the mother, who sets up an account with her daughter when the daughter is in elementary school, and it's in an account for the daughter in care of the mother, or the other way around. Once that child reaches 18, that child needs an account for herself or himself. So that was a lot of invalidity because of that, and other reasons for invalidity. We communicated by text message to all of those persons whose accounts were deemed invalid. And remember, the validation of a bank account, the government relies on the banking sector. It relies on the financial institutions, and there's little the government can do if the bank says, hey, this account, you know, is not valid. There's something wrong with it. Having communicated with applicants about the numbers of invalid accounts that we were receiving, we are able for that number to be worked down from 100,000 to last week it was at about 50,000. So there are a number of persons who have called into the call center, who have messaged, who have contacted me personally on social media and otherwise, who have said, you know, they've had their application in, they've had directed it to a bank account, and they have not seen it yet. I just want you to know that we are working on the validation for a number of accounts, and that work involves the top management of these financial institutions. The CEOs of these banks are involved and are putting all the resources that they can in order to expedite the validation and for minor issues to find a way to accommodate. Just coming here today, I got an update from the CARE team that over the weekend they had the banking, the financial institutions and all banks, you know, have had some of these issues, that over the weekend 20,000 of the 50,000 have been successfully validated, which means that we have reduced the number by approximately 40%. And those 20,000 will be queued up for transfers this week. And the management of the financial institutions continue to work with the CARE team in order to validate the remaining accounts, and will be in contact with individual applicants. And we won't stop until all of the eligible applicants are in receipt of their grant. In addition, we had an issue with some set cash applications, particularly from the tourism sector. And again, we've been in touch with a number of these applicants via the email address, which is info@wecare.gov.jm, or through the toll-free call center, or persons who have interacted directly through other platforms. There was an issue where persons who were eligible and whose eligibility had been communicated to them received a message a few weeks later to say they now were ineligible. And I know that caused a lot of confusion for a number of applicants. And what happened is that after their employers had uploaded P45s on your behalf, payments went through the payroll system to some of those same persons. And so when that happened, when TAJ processed again prior to making a transfer, it would seem as if the person was actually employed, because payroll deductions were coming up in April and in May, and so they were immediately taken off the list. On further investigation, and remember, this is a process that we have invited the Auditor General to review, and so we want to make sure that every transfer is made to persons who qualify based on the objective criteria. And where payments were turning up in April and May for persons who said they were laid off in March, it definitely generated a stop and a need for further validation. The good news is that Tax Administration Jamaica last week was in touch with over 300 employers who had employees in these categories. And as a result of that further validation, they were able to find that a lot of those payments that went through were residual payments, which should have been on the P45, but there were residual payments to persons who were genuinely laid off. And as a result of that further validation, over 5,000 set cash applicants who had received this message that they found a little disconcerting will be in receipt of the first of their set cash transfers this week. So 5,000 additional set cash grant transfers will be made this week, in addition to the 12,000 that were made before. Now, in terms of, so those were the two challenges on the bank accounts and on the set cash eligibility that we have worked through. With respect to going forward, the work program for this week and the program for next week, we will be making the transfers for the 5,000 set cash applicants who I just described received a notice of ineligibility after they were confirmed as eligible. And in addition, there are 19,000 set cash applicants who were laid off in April who will receive the payment for the month of April. And of course, they'll receive a payment next month as well. And those 19,000, when you add it to the 12 and to the 12,000, will bring us up to approximately 31,000 persons. In addition, we have, of the 1,200 small businesses that were confirmed as eligible, transfers have been made to 381 of them, and processing continues for the remainder. This week into next week, we are working on the validation for the general grants, and I want the public to understand that that validation process is quite involved because the number of occupational groups is quite large, and the database for the validation, will come from a different source. So the database for the validation of taxi for PPV licensee will come from the Transport Authority. The database for JUTA and JCAL and Maxi drivers will come from TPDCO, and the database for bar owners and barbers and hairdressers will come from the Ministry of Local Government. And that validation process is underway, and again, it will also be subject to an independent validation by the Auditor General's Department as well. Once that is completed, the transfers for the general grants will begin. With respect to the best cash applications, and we'd have received best cash applications from approximately just under 300 employers who were applying on behalf of approximately 22,000 employees who earn under 1.5 million who they had kept on staff. We are in the process of finalizing the validation for these, and there's some other issues to be worked through. And as soon as that occurs, the transfers will begin with respect to those best cash grant applicants. So that is the update from the CARE program. The good news is that in terms of numbers, a vast percentage of persons have received transfers, but in the case of the set cash program and the best cash program, recall that the transfers are not one time. There'll be a transfer to follow in subsequent months as well. So that's the overview, Prime Minister. Thank you.
Thank you, Minister Clark. I'll invite the Minister of Foreign Affairs while she makes her way to the podium. The Minister of Foreign Affairs has been doing an excellent job in ensuring that our Jamaicans overseas who are in distress are cared for. And Minister Johnson Smith will give you a very brief update in this regard.
Thank you, Prime Minister. Certainly, this pandemic has drawn high attention to the thousands of Jamaicans who are overseas on literally every continent of this world, involved in a range of activities. And although they're not, strictly speaking, members of the diaspora because they've traveled for temporary reasons, they still see the Ministry of Foreign Affairs and Foreign Trade as their primary point of reference, and we have sought to meet their needs in that regard. So we have placed a significant portion of our resources, human resources, both here at Capitol in Kingston and overseas, as well as our network of 90+ honorary consuls at their disposal in navigating the challenges that they're experiencing, that several of them are experiencing rather, as they wait to secure flights home or to arrive by sea. Emergency numbers and emergency contact information have been posted on our website, mfaft.gov.jm, as well as on social media for some time, and they have also been posted on the social media of our overseas missions, and they certainly have been and continue to be used, as there are hundreds of calls and emails fielded by us on a daily basis. And in that context, I just wish to take the opportunity to thank my staff, to thank all mission staff, or consular staff here at Capitol as well as overseas, who, even though working through their own challenges born of the fact that they are also in countries dealing with high outbreaks that are affecting either them personally, families, their community members, we express sympathies to all who have lost loved ones, as we know that among the Foreign Affairs family we have, and continue to pray for their comfort and to thank God for their continued strength as they continue to serve. In doing the work of service, we have been providing medication. We have created links with medical professionals within the Jamaican diaspora community, as well as counselors and spiritual advisors and mental health professionals, although these have been less required. We have located and sometimes arranged for and paid for accommodation and food for persons who have fallen on hard times or have run out of resources while waiting to return. And we continue to work with long-standing and new diaspora partners such as Grace Kennedy, National Bakery, and Jamaica Broilers to provide food packages to persons in need within the community. We have also been, of course, providing our consular advice, regular consular advice regarding visas and overstay. I remind everyone who is concerned to check the mfaft.gov.jm website or ministry's social media for the sites at which you can apply for your visa extension in the US, UK, Canada, or in Europe, depending on if you have if your overstay has been occasioned by travel restrictions as a result of COVID-19. In the context, of course, of controlled reentry, we have supported the return of persons from the United Kingdom, the US, Canada, Turks and Caicos, Antigua and Barbuda, Cuba, the Dominican Republic. And in that regard, we have been working with airlines, so we're adding to our list of services to glorified travel agents as well. We have been collaborating with partnerships and are scaling up in conjunction with Ministry of Transport and Mining, Ministry of National Security, and other stakeholders to bring more persons home in the next 2 weeks, as Prime Minister has alluded to. And to be clear, our nationals will still need to use the JAM COVID app, and flights will still be subject to schedule, although we are, of course, encouraging and experiencing more flights and seeking to leverage more otherwise arranged outbound flights so that we can see more of our nationals home over the next 2 weeks. This will include persons in the Caribbean who will fall within the travel bubble that Prime Minister has mentioned. So we note that our CARICOM neighbors, for the most part, are experiencing positive results and follow similar protocols such as us, and some are even experiencing better circumstances than us. We note also Cayman and Anguilla as countries which are experiencing positive results and who could therefore be counted among the bubble. I just note that I've been in discussions with my counterpart in Barbados and the ministry responsible for borders in Trinidad and Tobago about how we can best work together regarding the return of our nationals across the Caribbean and how the inter-regional air travel will work. And I've also been discussing with our mission in Port of Spain and our honorary consuls across the Caribbean to coordinate our next steps regarding our nationals in particularly far-flung nations. So beyond Europe, we're looking at Malta, UAE, Kuwait, Sweden, Belgium, France, closer to home, as well as Thailand. We're looking to bring home nationals from as far as Japan, and what we're trying to do is to consolidate a flight that will bring these small numbers together and bring them home in a way that's not only more affordable for them, but safe. So we understand the anxieties of those persons who are waiting to come home. We remind you that the emergency contact information is available on the website. We encourage you to stay home, stay safe, even as you wait, and to ensure that you check your email, check your inbox, and check your junk mail just in case to see if you've received an email from JAM COVID advising you to fill out, to complete your home quarantine information. This is necessary to process your application at this stage because we are moving from mandatory state quarantine in order to increase the number of persons that we can welcome home. So check your email, check your inbox, and complete the information so that your application can be processed through from conditional approval to travel authorization, as it's the travel authorization that's required to get you home. So thank you very much again, Prime Minister, for allowing me to share this information and for us to continue to scale up our activities to welcome more nationals home. Thank you.
Thank you. Thank you, Minister. Let me invite the Chief of Defense Staff to give a very brief overview of the process that is in place to ensure that members of the force who are involved in any shootings, that those shootings are properly investigated. Chief of Defense Staff.
Thank you very much, Prime Minister. The Jamaica Defense Force abides by the system of independent investigation of any incidents that members of the force are alleged to be involved in. And we are subject to investigation by both the Jamaica Constabulary Force and the Independent Commission of Investigations. With respect to the specific incident that the Prime Minister mentioned earlier, we immediately informed Indicom of the incident, and they got persons on site immediately. As far as I understand it, they put out information to the public the following day to indicate that they were in charge of the scene and the investigation and the information they were gathering. What has transpired so far, as they have confirmed, is that 4 soldiers involved were taken off frontline duties. They were interviewed by Indicom by the Friday. All the weapons involved were boxed by Indicom and are awaiting ballistics testing. And as I said, they have been taken off operational duties. We are giving them all the support that they need. I think they sent out another release earlier today indicating the progress. So it's a standard practice. We actually notify Indicom within 24 hours of any incidents, because sometimes they are not aware until we tell them, but we do have a protocol established. It is important for us to assure the citizens of Jamaica that your safety is important to us. That's our primary duty, to keep you safe, to uphold your human rights. And we have a very well-established program of training, education, and enforcement of human rights, respect for human rights by our soldiers. We are committed to ensuring that if there's any evidence of abuse of any of our citizens by our soldiers, that they will follow the due process that is established internally and externally by organizations like INDECOM. Thank you very much.
Thank you, CDS. I believe we have covered much ground today. I'm certain there are many questions, and we are prepared to answer.
It's from Ms. Dion Jackson Miller from Radio Jamaica. Of course, all our media partners who are online would have already been briefed in terms of what to do once they are live, and their background, and of course, microphone. So let's get everybody up on screen, and we start off with Dion Jackson Miller. Mrs. Miller?
Thank you so much, Naomi. Couple of questions. The first question in relation to CSEC, I'm asking for an explanation for Jamaica agreeing to bring up the CSEC and Cape dates from July 29 to July 13, given that the end of July dates were seen as important to allow our disadvantaged students who did not have adequate access to online teaching and learning and access to the internet more time to prepare. Given that reality, the announcement that Jamaica wanted to get the exams over before independence surely couldn't be an adequate reason. So I'm asking for the real reason. Second question has to do with the over 65s. Given the fact that we've heard COVID is likely to be around for quite a while, and perhaps our numbers may increase once our borders are opened. What's the plan? Is it that they're never going to be allowed to leave home again except for the once per day? And my third question has to do with public servants. Across the public service, people have been complaining that they've been unable to work from home because managers would not allow them to and would not facilitate that. And that even now, when physical distancing would be useful to still have work from home, they're still being told to come into work for June 1. So my question is, why hasn't the government done more to lead from the front in facilitating work from home? And can you do anything about it even at this stage? Thank you.
Have the minister come and answer the question about CSEC.
Thank you, Prime Minister. Dion, the Ministry of Education runs a collaborative establishment. It consults and it collaborates with our partners. And who are our partners? Our partners are all the Caribbean countries with the respective ministers and their respective cohort of teachers at all levels. Having reviewed the situation and based on the progress being made in Jamaica through the health services, the tremendous effort of the Minister of Health and his team, we are satisfied that the risk anticipated at the time that it was proposed is no longer as intense, and therefore it made way for us to be able to participate as they have chosen to in this examination. We have to collaborate with our educational partners. That is where we draw our strength as a region. And taking all factors into consideration, and also what you might not be aware of is that the curriculum at the time that we closed schools had almost been completed, only leaving about 2 weeks. And during the period of time that we have prepared to reopen at this stage, work has been done to complete those that have not been completed, and also the SPAs, the assessments that were a bit lagging, have been brought up to speed, and it was felt by the entire team that it is better to enable the students to get on with their examinations and to, rather than to wait, having completed their course of study and prepared to go to the exams.
What about students as partners, Mr. Samuda? Because the National Secondary Students' Council had said they were not consulted and they did not agree with the
who?
The National Secondary Students' Council.
Oh, yes. Well, we are driven by a principle that once placed in a position to lead, you must lead from the top. You must lead from participating at those who are particularly involved in setting policy and discharging policy set down by the government of Jamaica. We cannot lead. You could never imagine us arriving at a conclusion as to when to engage students in an examination by being guided by hundreds, and I suspect, if you take it to its full extreme, over 100,000 students. It has to be led by those who teach and who plan, and with the experience of others, both locally and internationally.
Thank you, Minister. Just to be clear, the question that Dion Jackson Miller asked regarding why before the holiday break, it would be very difficult, and as we discussed, to carry through the exam through a holiday period. It would be very disrupting, and therefore I suspect that the planners at the Ministry of Education wanted to find a date that would not disrupt the examination process with a holiday period. As it relates to consultations, I'm certain that there are always consultations going on, but as Minister Samuda pointed out, that and I share a personal experience which I shared with you, Minister Samuda, that when the question was asked about 3 or 4 weeks ago about CXC and what would be our position, and I had indicated that my preference would have been to give our students as much time as possible. After that, I began to get calls from principals who were saying, but Prime Minister, we are ready, and don't drag it out. And the principals who are really, in this regard, your frontline, your decision makers, it would be very difficult for the government to make a decision other than what the principals have decided and agreed in, because they are the ones who know the preparedness of the system. So our decision really followed what the principals themselves said were the best options. So I'm certain that you would have had discussions with the principals and with the National Student Council. So, you know, but as Minister Samuda says, in these times of national disaster, actions have to be taken. I would really have wanted more time, but if the principals are comfortable, they know the curriculum best, they know the students best, and I think CXC understands the challenge regionally as well, and they were prepared to go earlier than later. So I suspect it is a decision that will be beneficial for all. In terms of your question, the 65 and over, you know, the truth is, as I said in my presentation, the essence of the observation for persons 65 and over is to minimize action that is not considered absolutely necessary for your living and your well-being. So stay at home as much as possible. Avoid crowds, avoid public gatherings, avoid public transportation as much as possible. We review these measures weekly, and as we determine that the risk is diminishing, then the possibilities would exist for us to remove this measure. But as you have said, we are bringing in a new population post the closure of the borders. We are relaxing certain measures. So the possibility is that our numbers will increase, and our 65 and older, especially those with comorbidities, will be at even higher risk than they presently are. So now more than ever, you need to have this measure in place. In terms of the public service, I must confess, Dion, this is the first time I'm hearing that the managers in the public sector were not following the guidelines, because you will recall that the guideline was that our managers, our permanent secretaries, and section managers and directors that they should put in place measures to allow work from home. So now that you have raised it, I will at my next opportunity, speak with the Cabinet Secretary and probably convene very quickly via Zoom a permanent Secretary's Board meeting to hear what exactly is the situation on the ground. And I will report at our next press conference.
Thank you, Mr. Prime Minister. I just have one quick follow-up from the Senior Citizens Group, CCRP, and they actually wanted some more clarity on that, the issue of the 65 and older. Those with businesses who would want to go out, again, I think they're really pleading to see if they
so
would.
The way in which we have crafted the order, you will recall in my state, in the first set of orders, we said that you would go out for the what is called the necessaries of life. And we termed it at that time, it was food, it was medical, and I believe we had said financial transactions and exercise. We have modified the financial transaction segment to say, and attend to give oversight to their businesses. And it is crafted that way to specifically indicate that it is not meant that you should go there and operate and be amongst your customers and so forth, but to give oversight, make sure that it is being run properly, and then make your way back home.
Thank you so much. I think they're much more relieved at that. Let's go then to Mr. Dashan Hendricks of TVJ. Dashan?
Yes, good evening, Mr. Prime Minister.
Good evening, Dashan.
My questions surround mainly the reopening of the borders,
yes,
so to speak, starting tomorrow. And just correct me if I misquote you in any way, but I'm asking, you mentioned a travel bubble, countries yes, within a travel bubble, and that persons who come in from those countries may not be subjected to testing?
Yes.
Which countries are in this travel bubble? If you could just name some of them. And the second question relating to the opening of the borders, as of June 15, you said that non-national Jamaicans
yes, will
be allowed to enter Jamaica, but then they'll be encouraged to do voluntary testing. Why yes, voluntary? And if these non-nationals, which are tourists, will they be subject also to quarantine?
All right, so let's start with your first question. The concept of a travel bubble is not original to Jamaica. We have looked at other countries which are considering it and looked at the strategic deployment of it. Effectively, what the travel bubble would be countries that have equal or better performance in the management of the pandemic within their jurisdiction, have good results, and there are many countries like that within the Caribbean region that have had no cases for more than a week, that have cases below 100, that follow the same protocols like us, which would be in terms of the contact tracing, the management of clusters, using the public health system in a similar way to educate people. They have the similar orders in place regarding social distancing and other measures, wearing of masks, etc. So those countries would effectively have a situation that is similar or better to Jamaica, and therefore the risk level for bringing them back, providing that they are not going through a country that is not in the bubble. So if you're coming, and I don't want to call any country's name now because we haven't published the list, we have just given the criteria. But if you're coming from a country within our bubble, but you have to go through another country that is not within our bubble, then a different protocol would apply to you. The second question would be, if I'm interpreting it correctly, Dashan, why not ask everyone to test coming into Jamaica after the 15th? Meaning, why not ask Jamaicans and non-Jamaicans visiting to test? It comes down to, one, resources. We simply do not have the human resources to conduct that kind of test, and the logistics involved. As you can imagine, the strain that is being put on the public health system right now to test those that we are requiring to be tested under the present protocols for the controlled re-entry. I'm not seeing it physically feasible to be testing all flights that are coming in with 200 and 300 passengers at a time. The delay at the airport, it just would not make sense. However, this is not to say that they will not be tested. We will have provision for persons if they want to be tested. We have provisions for persons if through the screening process, and that's very important, even though we are allowing persons to come in, they will have to be screened. We will be doing the temperature checks. We have advanced machines at both airports that can do mass temperature checks. We will have our public health officers there who will be physically looking and observing for symptoms. And we will go through a process of sensitization. And if through that process we pick up persons who are of interest to us in this regard, then we will require them. The public health officer will have the duty and the authority to require them to be tested. And so there will be some testing capacity there, but I don't think it will be practical to say we would be able to test everyone. We will encourage persons, however, who come into Jamaica at that time to register on the Jam COVID app and set an appointment if they so choose. And we will, through that process, arrange for testing.
Thank you, Mr. Prime Minister. Just a time
one more
check.
thing.
It is 8:14. Dashan, if you would, given that you've asked two, let me just go to Janet Silvera, who is today wearing her hat as the Gleaner reporter, but of course Janet is also the head of the Montego Bay Chamber of Commerce. Janet? I'm sorry, Janet, could you unmute your mic for us? You're speaking, we're not hearing you, so could you unmute yourself?
Okay,
please?
thank you. Good evening. I have two questions. Indicom noted the absence of body cams in the police military operation in August Town. How many body cams are operational in the JCF and how many in the JDF? And why has the government failed to expand and operationalize this crucial check on the potential for police and military excesses, especially with soldiers being heavily involved in policing? That's number one. Number two, what safeguards will be there for Jamaican immigration, customs, and hospitality workers from potential COVID contagion if there isn't pre-testing of international travelers? And will there be restrictions for tourist movement throughout the country? Notice that beaches have not been reopened, so I'm wondering how that will affect those who are not staying on all-inclusive properties.
Very good questions. May I ask General Meade to answer your first question?
Thank you very much. I am unable to speak to the cameras that may be in the possession of the police, unfortunately. And I don't think the Commissioner is available right now. For the JDF, we only have a few sample cameras that we have been testing. So last year we got some and they failed to meet the requirements. They were not sufficiently rugged to stand up to the normal activities of the troops. And we got a different set this year that are currently undergoing testing. So we do not have wide-scale deployment of cameras at the moment, but we're going through the process that would allow us to have cameras for the troops to use when they are deployed.
Thank you very much, General. Just to say that, welcome, Minister of Tourism. just to say that the government is committed to increasing the number of body cams being worn. However, we have to social distance, thank you. However, we have to bear in mind, that we have very serious budgetary constraints, but the commitment is there and we continue to increase the numbers on a yearly basis. You asked a question, Minister of Tourism, regarding what would be the protocols in place for tourism workers, for people in immigration, if pre-testing isn't done. But before you come up, I'll just say to everyone, you could test yesterday and go on the aircraft, land in Jamaica, and test immediately after coming off the aircraft and be positive. So, and we agonized over what should we require regarding testing and what would be the best way to deploy testing resources. And I think the protocols that we have come up with are sufficient. It really means that we have to manage the risks in a different way. It means that every single Jamaican must follow the protocols and the orders under the Disaster Risk Management Act. That is what is going to, at the end of the day, ensure we keep our numbers low. But the Minister of Tourism can tell us a little bit more about our protocols.
Thank you very much, Prime Minister. I think that our ministry, along with Health, signed off today, in fact, with perhaps the most rigorous protocols anywhere in tourism. 122 pages of it, covering every single element of stakeholdership activity in tourism. And very central to it all is the protection of the workers of the industry. And every effort is being made to ensure, and indeed I want to make the point that some of the protocols that the companies themselves have put forward, and I've seen a number of them by way of their YouTube renditions of what their protocols are, that are well in excess and exceeds those that we have put forward in terms of how they are going to manage their space and, more importantly, provide the necessary COVID security equipment for the workers of the industry. The training that will be done, and in fact, we are rolling out a whole training program starting tomorrow, in addition to the online training which is now happening and the certification program that is being undertaken, providing many of our workers already with certificates from recognized American entities like the American Restaurants Association and the American Hotel and Lodging Education Institute. Those certifications have already been given to a number of the 7,000 tourism workers who are registered online for the programs that we have put forward. So we want to make the point that much more is going to be done. We're going to be encouraging a level of what we call security overlaying within the industry to protect the workers in particular, but also to make the statement to the world that Jamaica is a COVID resilient destination. And that is to say, we don't have all the answers to everything, but we certainly have put in place references that you can make whenever there's an issue and whenever there's a problem.
Thank you so much, Minister.
Thank you, Minister. The other question was about restrictions. We haven't put or designed any restrictions. As you would have heard me say, we are contemplating how we will reopen beaches and water parks and places of amusements. Those things we are contemplating, which some of them are recommendations within the protocols. So in another week or so, we should be able to say exactly how we will reopen that sector. So by the next time you see me at this platform dealing with these issues, we should be able to say something more definitively about the reopening of beaches and water parks and so forth.
Thank you so much, Prime Minister. In fact, many persons on social media were of that same mind in terms of asking that question too. Let's go to then Mr. Paul Clark from The Gleaner. Paul? Remember to unmute your mics as we call on you.
Yes. Hearing me?
Yes, hearing you now, Paul.
Right. Good evening, Mr. Prime Minister. Some quick questions here. Despite the island-wide curfew and the SOEs and the ZOSOs across half the country, murders have fallen only 2% year on year. Is that a mark of failure? And won't murders be projected to shoot up again with the curfews gone? Are you concerned that complaints against the JDF in the first 5 months of the year have eclipsed the number for all of 2019? And finally, the JDF has often been criticized for lack of transparency in feedback on investigations. Does this potentially compound the problem of low public confidence in the police?
Very good questions, and thank you for those questions, Paul. Let's start with murders. I think we would be under an illusion if we were to assume that the criminals have a conscience because we are in a time of pandemic. So we have never dropped our guard. We have never taken our eyes off the criminal element who continue to work to undermine our state and to prey upon our innocent people. The security forces are stretched now. They are conducting double lines of effort. They are trying to help with the logistics and management of the pandemic, in addition to maintaining the safety and security of citizens. The truth is that having managed by virtue of that effort to see a reduction of 2% is something that we should give some credit to our security forces. It is not just that there is a pandemic alone which would have caused that to happen, but our security forces continue to operate, and we see the effects of that in the increased recovery of firearms and ammunition, and arresting and bringing to justice wanted men and other criminals who are at large in our society. The other question that you asked about the JDF and the number of cases of shootings that are under question. Yes, it is a matter of concern, and myself and the Chief of Defense Staff, we have discussed this both privately and in the National Security Council. It is not something that we want to see get out of hand. I know that the Chief of Defense Staff has paid very close attention to this in the management of the force, and his officers are seized of this. I personally am very concerned, and I know that the officers of the force are very particular in protecting the image and good reputation of the force. This is not what the JDF projects, and I know that internally they will be doing everything to ensure that their members follow the protocols and follow the procedures. But you always have to remember, they too are in a difficult position. They are policing sometimes very difficult communities, and they too are at risk. And I think the public should also bear that in mind. I wouldn't join or support your view that the JDF has not been transparent in their actions. And I think over the years, I think the JDF has built up a very good reputation of being an institution of rules and procedures. And I believe that that will follow, and it will serve the nation well in terms of having a transparent process of investigating shootings that are under question.
Mr. Prime Minister, thank you so much. The time is actually 8:26. I believe we can wrap. There are just two quick ones that were sent to me in the Zoom chat, only because the reporters, I believe, aren't able to maneuver their equipment. Nika, I believe this may be Nika Lewis, is saying that since the work from home order has expired, does this mean the 4 p.m. end for work expires too? And Dashan was also asking for a clarification on his question concerning quarantining of tourists. When you answer that, I think we will be able to.
So you will recall in my presentation, the new curfew orders that are in place, I was very specific. I said that we have not issued any opening or closing times for businesses, except of course for bars, which that's under a separate order. So businesses within the 5 a.m. to 9, and then we'll increase to 10, will have to make their own determination of how much productive hours they will have and how much travel hours they will give to their, or allow their staff to have. So it is a part of returning to normal activities within the context of the COVID issues. So yeah, the 4 p.m. Cutoff time for work, that has been taken out of the orders since we had changed the curfew restrictions. And whether or not we will be quarantining tourists, the short answer to that is no. That's not the intention. However, if, for example, they were to get ill, then they would then fall under the protocols of the Ministry of Health, and then that would be a whole different situation. I want to thank everyone who has participated. We were particularly long today, but we had to be, because we are moving now into a new phase of managing the pandemic, and we had to make sure that we provide everyone with the information they need. This press conference will be broken up into smaller bits and transmitted through traditional media and social media, so that every Jamaican can be aware of what the new orders and protocols would be. And as we close, I want to take a moment to recognize the passing of our former Minister of Labour and Social Security, Minister Shahini Robinson. She was a stalwart, a patriot, and someone who deeply loved the Jamaican people. She will be missed. May her soul rest in peace. Thank you, ladies and gentlemen.
Thank you, everyone, and that concludes our press conference for this evening. You can join us again for another one.